On this video, I'm going to go through some general advice for a standard total hip replacement. Please check with your surgeon for advice that is specific to you. After a total hip replacement, there's 3 movements that it's recommended you avoid for about 6 weeks after surgery. The first one is hip flexion past 90 degrees. That's where you're lifting your leg up towards you. The second one is hip adduction, where your leg comes across towards your other leg. The third is internal rotation, where your leg twists inwards. We'll go through each in turn and I'll give you some tips of how to avoid these. If you imagine a right angle between your thigh and your body, you don't want that angle to go past 90 degrees. This could happen if you reach down to your foot or if you sit and lift your leg up towards you too far. You could avoid this by placing a pillow on the chair, and then when you sit down, the angle will be increased. If you drop something on the floor, best thing to do is to ask somebody else to pick it up. If not, using a handy reach or a litter picker can be really useful. If it's necessary to reach the floor, other ways is to keep your affected leg straight and slide it out behind you. Alternatively, you can kneel down onto your affected side, and that will reduce the amount of hip flexion. If you're in the habit of crossing your legs, I would suggest you can pop a pillow between your knees, and that will just remind you not to do that for the period necessary after the hip replacement. When you're turning, don't excessively twist towards the affected side. Instead, I would suggest you open your leg out and take small steps to make the turn necessary. When you get into bed, it could be useful to hook one foot under the other to assist it lifting onto the bed. I'd then suggest you put a pillow between your knees for comfort and to keep your leg in a neutral position. If you would like to sleep on your side with the affected side uppermost.